Hi everyone, it's your favorite survivor, Lucia, and I am here today for the second time around. That's how good the first conversation was with Dr. Taku, but I'm going to allow him to introduce himself. Thank you so much for having us again, Doc, and for your patience with us.
No problem. So I am Dr. Taku Mushambadzi, or Dr. Taku is perfectly, or Taku is perfectly fine. Yeah.
Okay, all right. Why do you shy away from the term doctor?
It's not shying away from it, but sometimes it just creates a barrier.
Okay, I hear that. Okay, thank you so much for having us again. We had a bit of technical issues with our mics the last time, but I hope today goes perfectly well. And our conversation is on chemotherapy, cancer treatments, and its effect on teeth. A lot of people have reported, myself included, that during treatment or after treatment, our teeth give us such big problems. And I thought it would be wise, or it would be good to just talk to someone who specializes in teeth and hear what they have to say and other tips that you can give us.
Sure, let's do it.
All right. So the first thing would be pre-treatment. What state should my teeth be in, or what's the good state for my teeth to be in pre-treatment, or what should I start with pre-treatment?
Okay, so pre-treatment and even no treatment, we want everyone's teeth to be perfect, right? Especially before treatment, we want to make sure that everything is healthy. We're not anticipating that in the next couple of months or years there's going to be any dental issue at all.
Okay.
So making sure that the gums aren't bleeding, making sure that there are no cavities, no deep cavities, no teeth that need to be extracted. And if any of those things do need to be done, that they are done well before the chemo or the radio or the hormonal therapy start.
Okay.
Yeah.
Right. Okay.
Yeah. So before treatment, just making sure that everything is perfect.
It's perfect.
Yeah.
So what would be wise would be I get my diagnosis and then I come in and check in with the dentist probably. And
yes, definitely. So a lot of the time the oncologist will actually refer to the dentist, and I guess it makes sense that the last thing that you want is a toothache when you're going through chemo or radiotherapy.
Fair.
So you come in, and if there's things that need to be done like extractions or whatever, we will definitely need to have that done 2 to 3 weeks before.
Okay.
Yeah, so 2 to 3 weeks just gives enough time for the bone to heal, for the gums to settle down, for the treatment, any treatment to work.
Okay.
And then you can proceed relatively comfortably.
Okay.
Yeah.
All right. Okay, that's good.
Yeah.
And let's say I have, because there's the pre-treatment that we've covered, but treatment also comes with its side effects on teeth.
Yeah.
So people have reported like your teeth are so sensitive. There's also a metallic taste in your mouth when you eat certain things. What are some tips that you can give us, especially when you're going through chemo, through radiation and hormonal treatment, that help us with our teeth?
Okay, so I'll start with the sensitivity.
Okay, yeah.
So it's unfortunately or fortunately, depending on how you look at it, your sensitivity can only be treated by the dentist. Okay. So there are things that you can do. I mean, there's certain toothpaste that you can use that'll make it a lot more comfortable for you.
Okay.
But a lot of the time, when these things start to happen after treatment, there may need to be some sort of intervention.
Okay.
Yeah.
Right.
So if cavities have developed, or if there's now abrasion of the teeth, or anywhere on the teeth, that's when we can do something about it.
Okay. Sorry, and just to stop you there, can this happen, like say I'm on my third cycle of chemo and then I start getting sensitive teeth? So it would be advisable for me to come and see a dentist, and then we can see how to.
Yes, it would. So a lot of the time, I mean, things like sensitivity, it's quite unlikely that it's something ominous that needs to be done, or something that's going on. So it can comfortably be done even whilst you're on your treatment. But because, let's say, hormonal, whatever treatment it is, your immune system may be a bit compromised. So we don't want you to just be coming here for no reason, right?
Fair.
Just for risk of infections and all of that.
Okay.
But if we can avoid you coming in during the treatment, then that's perfect.
Okay.
And then on the metallic taste, that is widely reported. And I mean, cheat codes for things like that are a little bit tricky. We can suggest things that may sound a little bit silly, but they may make you a little bit more comfortable.
Okay, all right.
A simple one would be, if you have the metallic taste, don't use metal cutlery.
Okay.
Yeah.
Yeah.
I mean, it could just make it worse. There's other trains of thought that will say rinse your mouth with something flavored, like a flavored mouthwash or whatever. But mouthwash again, it's a bit of a gray. It's a gray space.
Okay.
Because mouthwash, if it has alcohol, number one, it will dry out your mouth.
Okay. All right.
If it's antibacterial mouthwash, it can predispose you to getting things like oral thrush, things like that.
Okay.
But yeah, avoiding metal cutlery, trying to find things that have a bit of a strong taste, even though, I mean, there's the taste sensitivity as well.
Yeah.
Some food doesn't taste the same.
Yeah.
So it's just really finding little tricks that can make you a little bit more comfortable.
All right, that's fair enough. I was on to lemon water, and that worked for me, because they say you have to drink water and stay hydrated, but also water just won't go down.
Yeah.
Another thing that I found is I had to use so much ice in my water just so that I could drink it. Like,
Okay.
so much ice.
Okay.
So how does that work now? I have sensitive teeth and I need to put ice in my water.
Yeah. So, I mean, one of the most frustrating things was probably not being able to enjoy food, or even not being able to enjoy water, right?
You can
because
say
of your
that
teeth
again.
and all of that.
Yeah.
So it just comes back to making sure that we know what's going on in the mouth, and even the patient knows what's going on in their mouth.
Yeah.
And even before the treatment, we can anticipate that, that's a dodgy looking tooth. It might give you problems in the future. And then we can, do certain things, make you at least more comfortable.
Okay, all right. And let's say for things like bleeding gums, do you have any home remedies? Not so expensive, because you guys charge an arm and a leg sometimes, just sometimes. But are there any home remedies that you can advise that can help us through?
So bleeding gums, the simple things to do are to make sure that you're brushing your teeth. Okay, twice a day.
All right.
Okay, and then flossing.
Okay.
I know it's a chore. We don't enjoy doing it, but we just have to do it.
Okay.
Yeah, so flossing is probably the number one thing that can keep your gums from bleeding.
Oh, okay.
Yeah.
All right.
So those are the cheap things that you can do. Making sure that you're brushing and making sure that you're flossing.
Okay.
Yeah.
And with the mouth sores, because sometimes you get these mouth sores or sores on your tongue and under your tongue. What would you recommend?
So before the treatment of that, a lot of the time these things are self-limiting, meaning that they will disappear on their own.
Oh, okay.
Yeah, but that process to them disappearing is, that's the discomfort that we want to get rid of.
Oh, okay.
So there are, mouthwashes that can soothe the mouth, but again, those mouthwashes must be used very carefully.
Okay.
Because we don't want to wipe out all the bacteria, the good bacteria in your mouth, and then now get fungus and all these other things growing.
Okay.
So mouthwash must be used very carefully. The cold water sometimes is reported to help with those ulcers as well.
Oh, okay.
Yeah.
All right.
So even just like ice or anything cold can just soothe them a little bit.
Okay. All right.
And avoiding toothpaste that are a bit too harsh. Yeah. So
walk us through that. With the mouthwash and the toothpaste.
Yeah.
What am I looking out for? I'm avoiding alcohol. What else am I supposed to look
so
out
for the mouthwash, you're avoiding alcohol. You are avoiding. I mean, the mouthwashes that as soon as you put them in your mouth, they are burning. That does not mean that the mouthwash is working extra.
Are you sure? Because it feels like
you feel
it.
fresh after, but it's So there's things like the menthol and all these things that are in the mouthwash that give you that sensation. Those things will dry out your mouth.
Okay.
Yeah. So your mouth will feel clean, but it will be dry and then predisposing you to cavities and all of that. So avoid anything with alcohol, avoid anything with that extra strong burn, and anything with that is branded antibacterial, use very carefully or on prescription from your doctor or your dentist.
Oh, okay.
Yeah.
All right. Okay, cool.
And then toothpaste as well. I guess it's just the standard toothpaste, as long as it has fluoride. Because fluoride, again, it helps keep your teeth safe.
Okay.
But if it is used in a well-regulated, I mean, not like swallowing the toothpaste and all that, you don't want too much fluoride in your system, but in the prescribed amounts, it is perfect for keeping your teeth.
Okay, all right, cool.